This video will give you a brief tour of the cervix and the uterus. First, cervix. And the annotation is meant to orient you, and I'll just go through that. It's indicating here the beginning of the transition, which is fairly abrupt change from the simple columnar ciliated epithelium of the uterus, which you will find here and all the way up about right into this area. And these are the cervical glands that secrete mucus, and they lubricate the vagina, and as well as glands in the labia majorum and down at the entrance to the vagina from the outside, because the vagina itself has no glands at all. So if we enlarge this at this end, then you can see the simple columnar epithelium, which is sometimes it's not sectioned right through. Like here's a pretty good sectioned area where you have the simple columnar epithelium, although this is cut at tangential, so it looks like pseudostratified, but it's not. So here's a better view of the lining of the uterus cells with the simple columnar and the ciliated epithelium. It's pretty blurry at this magnification. And if we reduce the magnification, go back to the orientation, then you can see that the lining here, this is simple columnar epithelium with cilia. And then as you move along, we come to the point of transition where this is the abrupt change from the simple columnar ciliated epithelium to the beginning of the transitional, not transitional, but the beginning of the stratified squamous non-keratinized epithelium. Now you do have an abrupt change here, and at this point where you have that change in epithelium, certain types of viruses can cause cancer here, cervical cancer. Now if you move along and now come to the actual entrance to the vagina, then you see it's stratified squamous non-keratinized epithelium. So hopefully that will give you some orientation to the cervix and the connection with the uterus and the connection with vagina over here. So now let's go to the uterus itself. The uterus has an endometrium, a myometrium, and a perimetrium. Now you'll not be able to see the perimetrium here because this sample was cut as a section out of the uterus and includes the endometrium on both sides of the lumen of the uterus, but the outside covering of connective tissue and the peritoneum and the mesothelium on the outside is not present. So if we enlarge this middle part, it is just a dense population of smooth muscle cells oriented in different directions. You can see here they're in cross section here and longitudinal section over here, and in between is connective tissue and blood vessels. So that's the myometrium. And then over here, this is the endometrium, and this is these are long tubular glands. And at this stage, this is a stage of proliferation where the glands are getting longer. And that's one thing you learn in WebMic as well as the lecture, is the different stages of the endometrium in the ovarian cycle, in the menstrual cycle. So be sure you try to correlate all that, but as far as identifying the uterus, you look for these tubular glands, and then the lining would be simple columnar cells with cilia. And of course in here are capillaries and connective tissue with quite a bit of space of extracellular material that absorbs water, so it's pretty hydrated in this region. And then of course at the base of the endometrium, that's where you have the cells undergo mitosis that give rise to new tubular glandular cells after the endometrium is sloughed off, but it remains at this functional layer. Again, you'll need to correlate that with the lecture. Okay?